Amazing. I'm going to be sharing 5 lessons that I've learned over 2 years of building a healthcare SaaS company. So a little background on me. Ever since I was a kid, I wanted to start a company. I became interested in digital health and telemedicine through a university project. And then I worked at an education tech company called Top Hat and a marketing technology company called Turnstile. Kind of combined all those things and saw the opportunity to start OnCall. So the thesis that we work behind at OnCall is that the vast majority of healthcare appointments do not need to be in person. Consumers and patients are demanding more convenient ways to interact with their own trusted healthcare providers, especially using personal devices. But most healthcare providers don't have the technology or the support to effectively incorporate these types of tools into their practice. So enter OnCall Health. What we do is we provide clinicians, clinics, and systems with the ability to offer things like secure video appointments, texting, and digital forms and assessments. So we have over 1,000 healthcare providers that use this today in their practices. This is our team, dangerously standing in the middle of King Street. And other than the team, probably the most interesting thing about working in OnCall is the different types of healthcare providers that we get to work with. So it's been really interesting seeing all the different ways that virtual care technology can be applied. The number one for us is mental health. So a video counseling appointment for mental health therapy can be as effective, or in many cases more effective, than an in-person mental health counseling session. So we work with a lot of psychologists and social workers. That being said, we also work with a lot of primary care clinicians, speech-language pathologists. It's been really cool kind of seeing where this can be applied and working with some pretty impactful organizations across North America. So let's dive into some lessons learned. Super exciting one right off the bat. So knowing your legal and regulatory environment, very important for new healthcare companies. We budgeted a lot for this early on, and I think it was one of our best moves. Understanding the privacy and security requirements is extremely important. We were able to connect with a lawyer who's also a member of the board of the Royal College of Physicians and Surgeons in Canada, and she helped us develop our privacy policy and then eventually connected us with a firm to work on our privacy impact assessment and threat risk assessment. These are crucial foundational pieces and probably step number one for any healthcare tech company to figure out. In terms of the virtual care landscape in Canada, it's quite fragmented. So most provinces don't have any sort of policy around whether physicians can actually use virtual care in their practice. The West Coast is the most progressive. They actually allow physicians to use whatever technology they want and get compensated by the government for doing a virtual care consult. And again, they can use whatever tech they want as long as it's compliant. Ontario, on the other hand, has a sort of government monopoly on telemedicine. So in order for a physician to do a virtual consult and get compensated, they have to use a government software. So as a result of this kind of fragmentation, we work a lot more in the private sector, which I would say is quite underrated in Canada. A lot of people don't talk about how much of our healthcare system is covered by insurers and employers. So, as a healthcare company starting out, it's always important to look at those routes too. For us, we found that the private sector is a lot more open to adopting technology faster. And it's also easier to prove an ROI when you're working with them to improve revenue or profits. The next lesson learned is definitely that for us, the on-demand or marketplace model is not necessarily ideal everywhere, especially in healthcare. So on-demand services are exciting, they can be very disruptive, they can get a lot of traction, but when it comes to healthcare, you really have to think about where the technology is going to fit and complement with our existing healthcare system. You also have to think about the way that clinicians are going to use it and how they can actually achieve the best patient outcomes with that technology. So in our case, OnCall actually started out as an on-demand app. You could download the app, you could see a doctor on demand whenever you wanted. But after a few months, we started speaking with a lot more clinicians, and we kind of realized that virtual care technology can actually be way more effective if it's used to augment or complement existing healthcare relationships. Maybe it's for an initial consultation before an in-person meeting or for a follow-up appointment. Just having the ability to also have a continuity of care and meet the healthcare provider in person when appropriate, but then over video or text also when appropriate, goes a long way. So we've kind of evolved into that. And I believe that's where virtual care will end up, where it's just another tool that healthcare providers have in their practice, like an EMR. Next lesson, be picky about your early enterprise customers. If you have an interesting product or something that's new and innovative, you're gonna get a lot of sales meetings and interest early on. But be picky about who you work with, because those first customers are going to impact what your product looks like and the features that you build. So even if the revenue opportunity is amazing, it's really important to choose who you work with. And I would say always go with much more established companies that have a workflow, because you're gonna have to build something that fits with their workflow. Make sure you build something that can be sold to other large organizations as well. When you work with startups early on, you never know what that company's gonna look like in a year. So definitely something to keep in mind. This is a really important one to me, putting a premium on good design. So the top two things we always say we provide to our customers at OnCall is security and then accessibility. When it comes to healthcare technology, you're dealing with such a wide range of comfort levels with technology in general. And if you're actually implementing technology in a clinical setting, we're not working just with like millennial marketers here. We're working with clinicians that have practiced for perhaps decades and patients that may be in distress. So I would say you have to take user experience design to an extreme and make sure that you partner with a designer who understands that and can make every single screen super simple and understandable. Finally, technical support and customer positivity. Human technical support and customer positivity are super key. So we have a super high touch customer success team at OnCall, and what they do is they onboard every single clinician that uses our system one-on-one, and then they're super proactive to make sure that they get the most out of the system and that they actually use it in their practice. And I think that's actually the thing that our customers value the most about our service, is that we're so proactive. These are like this kind of thing, high touch technical support, is something that startups can uniquely use to differentiate over much larger organizations, because a much larger enterprise might not take the time to work with a customer one-on-one like that. And then we've been trying to build a culture around customer positivity. So we always try to speak about our customers, even internally, in a positive fashion. Even if we're getting frustrating support tickets that aren't even related to our technology, they're just about Gmail or whatever. We always try to be patient and work with people, because we think that will result in good word of mouth. So these are some examples actually of real emails that were sent unprompted to other psychologists across Canada. And they actually ended up sharing those with us. But these went a long way, probably generated as many leads as our marketing and sales efforts. And I'd say that you want to make sure that or just know that clinicians talk. Like, they have online forums, they have email lists where they're communicating about new products and services that are coming onto the market. So be aware of that and make sure you maintain your reputation. Anyway, that's all I wanted to share. Thanks so much. We're also hiring at OnCall, so if you're interested in learning more, please get in touch. Thanks so much.
We're going to take one question.
Hi, thanks for the talk.
Thank you.
You started off saying that 90% of our hospital or care visits are unnecessary in person, but it sounds like you kind of pivoted to the 10% of additive services to existing clinics.
So I just want to clarify the percentage there. I think the percentage you're referring to is 92% of patients that use virtual care are highly satisfied with virtual care.
Okay.
Is that what you were referring to?
I didn't get to the question yet.
Okay,
So
sorry.
the question is, what needs to happen for this to become the mainstream versus the additive, to really reduce the cost of healthcare and better service?
It's a great question. Well, I mean, if we go back to that map there, you can see that most provinces don't have any sort of virtual care billing code, and we're seeing other startups that are going outside the system, right? You got your Maple, Dialogue, Akira, which is a fine model, but it's going against the grain of our healthcare system. So in order for virtual care to get adopted in a hospital setting, I mean, it's already happening in Ontario with OTN, but I personally believe that we need to open up billing codes so that clinicians everywhere can use just whatever tech they want to use, whatever integrates with their own EMR, whatever works best with their workflow, and allow innovation to kind of grow. And I think that will result in virtual care being kind of ubiquitous. Also just time, probably like another 20 years or something. Thanks.